Are you or someone you know suffering from persistent knee pain? Is knee replacement surgery being considered? Let's take a moment to understand knee arthritis, a common precursor to such a surgery. Arthritis is a condition that leads to the gradual breakdown of cartilage in the knee joint, resulting in pain, swelling, stiffness, and a reduced range of mobility. Now, there are three primary types of arthritis that often necessitate knee replacement surgery. First, we have osteoarthritis, a degenerative joint disease that often affects middle-aged and older adults. Next, there's rheumatoid arthritis, an autoimmune disease that can occur at any age. And finally, post-traumatic arthritis, which can occur following a severe knee injury. These conditions can significantly impact the quality of life by limiting your mobility and causing constant discomfort. Now that we've understood the condition, let's move on to the symptoms. For some, the pain begins subtly, gradually intensifying over time. For others, it strikes without warning. Knee arthritis is a silent assailant, slowly eroding the cartilage in your knee joint and manifesting in a variety of symptoms. Persistent knee pain is a common sign, especially during activities that put weight on the knee. This isn't just a fleeting ache or discomfort, it's a constant nagging pain that hampers your mobility. Along with this discomfort, you might notice swelling and inflammation around the knee joint, a visual sign of the battle raging within. As the condition progresses, stiffness sets in, and the knee's range of motion becomes limited. You may find it increasingly difficult to walk, climb stairs, or perform daily activities due to this pain and dysfunction. And if you've tried conservative treatments like medication, physical therapy, or injections and the pain persists, it's a clear indication that the arthritis is advancing. Understanding these symptoms is crucial, but it's equally important to be aware of the potential risks associated with knee replacement surgery. While knee replacement surgery can offer relief, it's not without its risks. Just like any surgical procedure, it comes with a certain degree of uncertainty. This is why it's crucial to be informed about the potential risks associated with the procedure. One of the most common risks is infection. After surgery, there's a possibility of developing a post-operative infection at the surgical site. This is often managed with antibiotics, but in some cases, additional surgery may be required to treat the infection. Another risk is the formation of blood clots. These can develop in the legs, known as deep vein thrombosis, or in the lungs, a condition called pulmonary embolism. Both can be serious, but they're typically preventable with medication and early mobilization after surgery. There's also the potential for nerve or blood vessel damage during surgery. While this is relatively rare, it can lead to numbness, weakness, or even paralysis in the affected limb. Implant problems, such as dislocation, loosening, or wear of the artificial joint over time can also occur. This could necessitate a revision surgery, where the worn or loose parts are replaced. Some patients may experience stiffness or instability in the joint, making it difficult to bend or straighten the knee fully. And in rare cases, there can be allergic reactions to anesthesia or the materials used in the implant. Risks can sound intimidating, but remember, the prognosis after knee replacement surgery is generally favorable. Many patients breathe a sigh of relief post-surgery, enjoying significant pain relief and improved knee function. Indeed, the prognosis after knee replacement surgery is generally quite favorable. However, individual outcomes can vary, influenced by factors such as the severity of arthritis, overall health, and adherence to post-operative rehabilitation. Physical therapy plays a crucial role in this rehabilitation process. Following surgery, patients typically undergo a regimen of physical therapy to regain strength, flexibility, and mobility in the knee joint. This journey may be challenging, but it's a vital step towards reclaiming normalcy and comfort in daily life. The long-term benefits of knee arthroplasty are numerous. With proper care and rehabilitation, many individuals experience a marked increase in activity levels and an overall improvement in their quality of life. The ability to move without pain can open up a world of possibilities, from simple pleasures like walking in the park to more strenuous activities like hiking or dancing. However, it's essential to remember that knee replacement surgery, like any medical procedure, comes with potential risks. Discussing these risks, along with the expected benefits and outcomes with a healthcare provider, is a crucial part of the decision-making process. This conversation can help ensure that you are making an informed decision that aligns with your personal health goals and lifestyle. Remember, Knowledge is power when it comes to your health. Subscribe for more medical advice and always discuss your treatment options with your healthcare provider.